Hello, this is my final presentation for global health on COVID-19 responses in various countries and just various facts and information about how the disease has taken place in various places and in the United States. So to start off with, I'll talk about the definitions of pandemic and epidemic. So according to Merriam-Webster's dictionary, epidemic is affecting or tending to affect a disproportionately large number of individuals within a population, community, or region at the same time. Or the noun is an outbreak of disease that spreads quickly and affects many individuals at the same time. A pandemic um, is occurring over a wide geographical area, such as multiple countries or continents, and typically affects a significant proportion of the population. Or the noun form is an outbreak of a disease that occurs over a wide geographic area, such as multiple countries or continents, and typically affects a single or a significant proportion of the population. So, COVID 19, we've all heard this phrase about a million times at this point in 2020, and I'm sure we're all sick of hearing about it, but it's crucial to know, obviously, to watch out for symptoms and to avoid. So, the clinical description, it presents as a very wide, kind of non-specific, just general respiratory um, class of symptoms, but there can be a fever, cough, sore throat, malaise, headache, muscle pain, nausea, vomiting, diarrhea, loss of taste, loss of smell, dyspnea. I think that the main things that people are looking for is that shortness of breath or the loss of taste or smell. Um, some individuals are asymptomatic but can be carriers of the virus. We've heard this time and time again, just so that we're all careful because we can be spreading the virus asymptomatically to people who then experience symptoms, and that can be bad. Some require supplemental oxygen, antivirals like remdesivir. The very dire cases require intubation, but again, some people don't require anything. The laboratory criteria for diagnosis, there must be the COVID test, there must be a positive. Um, there have been false positives. Obviously, there's various ways to get the COVID test. I think we've all come to know that the most reliable is the swab that's deep in the nair, or just of the respiratory system. The rapids have not been known to be effective, quite like the others. Asymptomatic and symptomatic individuals can get tested. I know at research, everybody gets tested to be on the inpatient units, because obviously, if you have COVID, you're going to be on a COVID unit. We had a patient during my clinicals that was on our floor, and we were wearing proper PPE that would be suitable for the COVID floor, but we didn't know he had COVID, and he had COVID the next day. So that was unfortunate, but it was a good thing that we were wearing the PPE, so it wasn't really an exposure. The case definition is a positive COVID case is defined as a person with laboratory confirmation of COVID-19, as I said, and irrespective of clinical signs or symptoms. So, I mean, asymptomatic or symptomatic. A suspected case is defined as acute onset of fever and cough, weakness, fatigue, malaise, sore throat, dyspnea, anorexia, diarrhea, all these things, altered mental status, and the epidemiological criteria of being in a location of a high risk or of transmission, or being in an area when community transmission, or in a healthcare setting. This is according to the World Health Organization. The causations. So, in the agent of this is the virus. It's in theory, it started off in Wuhan, China. Um, I say via a bat, but that's just the theory that it started off in that fashion, and it spread very rapidly. There's lots of conspiracy theories over what happened, but this is at its most basic. This is the story, the legend. It spreads. It's known to have spread to animals. We thought at first. I think there was an article that animals can't get it, and then it was they could. So, and obviously we know that people can get it. People who are immunocompromised, have respiratory or other comorbidities, older adults, healthcare workers, etc., are at higher risk for getting this virus. Obviously, if you have like, I know diabetes is one, heart disease, kidney disease, anything like that, like, obviously, a, a virus is going to exacerbate your symptoms more than if you're, a healthy a completely healthy person. But also, there have been cases where people who are completely healthy do get COVID, and it does not turn out in an ideal fashion. There's various environmental factors that can influence getting COVID, including being in a crowded space, lower income areas, with lack of education, lack of sanitation, lack of access to screening services, people who don't have access to the news or technology or anything, maybe aren't seeing what's going on, so they're not being as cautious as they should be. Case rates for countries. So my countries are United States, Japan, and Nicaragua. So in the United States, on December 8th, there were over 200,000 new cases. Since January 21st, 2020, there's been a total of 15 million and an average daily cases of 100, and the average daily cases per 100,000 people in the last 7 days is currently at 61.8. The total deaths as of December 9th at 12:19 in the afternoon was 285,351 people. Japan, as of December 8th, there were 2,158 new cases. Total deaths were from January to now was 2,334, and there have been a total of 165,840 cases since January 2020. New cases are going up. As in the beginning of October, there was approximately 300 to 500 new cases per day, and in November there have been 1,000 to 2,000 per day, so that's not a good trend. Nicaragua, on December 8th, there were 49 new cases. In total, there have been 5,887 cases since the start. There have been 162 deaths. 4,225 people have recovered, and this has been a steady increase since May of 2020. And currently, they're at the highest point when you look at the graph of cases. So 3 key organizations that have helped with the impact of COVID are the World Health Organization, the CDC, and the United Nations. So the World Health Organization warned the world about a pneumonia of an unknown cause that will later be known as COVID-19. The World Health Organization has been the lead to many different initiatives, like a fundraiser to raise money for the pandemic responses called COVID-19 Solidarity Response. There's also the United Nations COVID-19 Supply Chain Task Force and Solidarity Trial for investigating what treatment options may be useful around the world. The CDC is obviously here in the US, but globally it has worked to come up with solutions to the crisis. They want to strengthen the capacity to prevent, detect, respond to COVID cases via timelier data, strengthening public health efforts. They want to mitigate COVID transmission in the community and across the borders in public settings. They want to ensure readiness to implement and evaluate a vaccine and therapeutics, which is the stage we're at now. Obviously, now that the vaccine, especially for healthcare workers, is coming out, the CDC has provided guidance from everything from social distancing to wearing a mask to washing hands and more. That's who we've been hearing from and kind of getting our advice from. The United Nations impacts global health in one way by seeking to fund 3 plans. One is to create strategic preparedness and response plan to address immediate health needs. There's a global humanitarian response plan that helps ease impacts of COVID in 50 vulnerable countries. And finally, there's the United Nations framework for an immediate socioeconomic response, and that is to help social and economic recovery in middle to lower income countries. Access to health services and poverty. So, I feel like we've heard this throughout the pandemic, but obviously lower income people are going to be influenced in a more negative fashion via this pandemic. So, according to an article, COVID-19 is disproportionately impacting people of the lower socioeconomic status. This is because people in inner cities, or just generally people of lower income statuses, don't have the same access to high quality healthcare. They're not having this social media, this constant news. They don't have access to technology that is saying what's bad, what to do, what to follow. They don't know. Not everybody has the latest and greatest of everything. According to the AMA, according in studies in the United States, in big counties of like big cities like Philadelphia, New Orleans, LA, and Boston, where the population is majority non-white and the median income is 60 grand. COVID death rates were more than 9 times higher than those in areas of predominantly white, so and more upper class. Um, Infection and death rates, according to this article, were also 3 times higher in non-white counties. This is, yeah, counties. Inherently, this article states that if someone is lacking the ability to go to lacking the place in general to go to get their healthcare needs, they're not going to they're not going to know where to go when they maybe have COVID, and they maybe don't even know the symptoms that they're looking out for because they don't have access to technology. If they're in poverty, they're not focused on a pandemic, they're focused on where they're going to get their next meal. So it's just kind of a slippery slope of things that are just being negatively impacted here. Culture and COVID-19. So in the United States, I think the common complaint is that like people aren't wanting to wear masks because that's an infringement on their rights. And this is all about, the United States is all about freedom and rights for all and not infringing, the government not infringing. And that's kind of impaired our response to maybe wear a mask because science has told us that it works. Japan, the biggest thing for Japan is that they already have an existing mask culture. People wear it for medical reasons and to conform to society's norms. So it's not really a huge thing to ask people to continue what they're doing. Historically in art, there's people have been depicted with masks on, and just like during modernization in the late 1800s, infection was a concern, so people wore masks. In Nicaragua, there have been tensions in the Nicaraguan government that I've covered in a previous assignment, but the president has been kind of blamed for blatantly disregarding the citizens and just really not giving the response to COVID that the citizens desire. So the healthcare response, the last slide. Healthcare systems in the U.S. are extensive and advanced with the technology used. I think that the big thing here, according to the CDC, is that it is crucial that we allow hospitals not to be overwhelmed, and that has occurred. Hospitals are overwhelmed. For our own research medical center, they are extraordinarily close to the cap of patients. They've had to send patients to CenterPoint, and the surge is not really done because it's going up by the day, and but however, in the United States we do have the technology and a good healthcare and quality healthcare to treat people, so that's the good thing here. In Japan, in an article by The Diplomat, Japan's universal healthcare system has led to COVID-19 success. That is because there is no gatekeeping, there's universal health insurance for all, and there's a uniform schedule fee that helps all people, not just people with a certain socioeconomic status. And in Nicaragua, since Nicaragua is an underdeveloped country, they don't have access to extensive medical advancements like we do in the United States. According to Reuters.com, in May, Nicaraguan hospitals are packed with patients with respiratory issues, which caused doubt on the country's counting system for COVID, and so they reported low numbers, and this lack of support from the government also led to lesser resources given to the hospitals. And that is all I have. Thank you very much.